Good afternoon. Thank y'all so much for joining us. I'm Tammy Epps, and I'm the Director of Media Relations at Prisma Health. As you know, our hospital system and our physicians have been working really hard on this measles outbreak. From anything that you can think of that they could do to help protect our community, they've been doing it. And so today we have some additional measures that we're going to take to try to do even more to protect our community. And so with that, we have three of our physicians here with us today. We have Dr. Kendreia Dickens-Carr, who is an OB-GYN. We have Dr. Anna-Kathryn Burch, who is a pediatric infectious disease physician. And we have Dr. Robin Lacroix, who's also a pediatric infectious disease physician. And so we're going to start with Dr. Lacroix, and she's going to give us some additional and new information. And thank y'all so much for joining us. Give me 1 second. Dr. Lacroix.
Thank you, Tammy. I think I'm unmuted now. Thanks for setting the stage for a press release that will be circulated that is outlining some additional measures. Obviously, this is an ongoing, evolving situation, and we have seen the numbers increase, decrease over time, and certainly know that the number of at-risk individuals in all of our communities still continue to be an at-risk population. And those are children too young to be immunized. Those are immunocompromised people, both children and adults. Those are children and adults who have not had two MMR vaccines. And so in an effort to look at how else can we protect those folks that are coming to us for healthcare, our emergency departments will be implementing masking for visitors and the patients as they enter the facility. There are a number of reasons behind this. If you think about a mechanical barrier being there, if you have watched the commercials of the guy who sneezes and the particles go flying out, that is exactly what happens when someone sneezes or someone coughs. Those respiratory droplets are extruded into the environment. So mechanical barriers to help keep that from happening, like a simple surgical mask, the ones that were highly utilized to help decrease influenza outbreaks and other outbreaks such as COVID, that's a mechanical barrier to stop those respiratory droplets. So adults and the caretakers that are coming with them, the people that are bringing them to the emergency department, will be asked to mask until they've had time to assess the problem that they're there for. If any of you have experienced an emergency room visit, you know that you come in through a large open space. You're quickly assessed by a nurse in triage. You subsequently then receive what's called a medical screening exam. And through those processes, we will be able to determine folks who are at greater risk to potentially have measles or any other easily transmissible respiratory virus. You know, this is RSV season, this is flu season. There are a number of circulating viruses out there. Additionally, being able to create spaces that we can move people who need to be in a more contained situation, because we're still assessing what is the disease process that's brought them to the emergency department. During that time, they'll be moved to additional spaces. This will be implemented across the Prisma Health footprint because, as we heard yesterday and on the briefing from DPH earlier today, that certainly we now have at least a confirmed case in the Sumter area. We know that the PD is now at risk. We have facilities in those locations that are serving the families there. And so assuring that our PD, our Midlands, our upstate emergency departments are able to implement measures to continue to provide additional protection between the numerous other reasons that people are in the emergency department for injuries and heart attacks and strokes and other conditions that place them at risk too for acquiring a respiratory infection. This masking will also be implemented in children 2 and over if it is medically safe for them to do that. And younger babies, we always counsel families to talk about with young babies and carriers to tent them, to protect them from a number of different viral infections they may be exposed to, whether they are in a commercial environment like grocery shopping, or if they're in a healthcare environment. So those measures will be rolling out to our emergency departments, beginning with the announcement that we have for the community to make them aware.
Dr. Lacroix, how long will the patient's family, those visiting the ER, how long will they have to wear the mask?
Until the medical screening evaluation is completed, meaning the time that it gives us to assess what is the person there for, what is their risk for having a transmissible infection.
And so, Dr. Corey, just to clarify that the masking is for everyone who's there, whether they're a patient or a visitor.
That is correct, because obviously where household members bring another household member in, they have all shared a common exposure with that ill person that's seeking medical care.
Thank you. Now we're going to go to Dr. Kendreia Dickens-Carr, sorry. And she's going to talk a little bit about OB-GYN and some additional things that we're going to do for those patients.
Good afternoon. Thank you for having me. First of all, I would like to concur with Dr. Lacroix. The OB unit as well, our floors will as well enforce strict masking until we can determine if any patient has any possibility of having any infectious disease, which means that our patients, which can enter it through the main doors, through the emergency room, we're just going to mask them up. And when they come in to be triaged, once we determine that they don't have that risk or that they are immune, which I will discuss a bit later, then we will be able to unmask them. So the key thing here that I want to stress is a lot of this is preventable. Okay. So in my realm, dealing with pregnant women, you not only have the mom, you also have the baby that you're thinking about as well. In this case, measles infection during pregnancy poses a severe risk. And when I say that in pregnancy, that's women who are not immunized, women who have not been vaccinated, received at least one, preferably two measles, mumps, rubella, MMR vaccinations, or have not had measles in the past. These women have an increased risk of pneumonia, hospitalization, and with pregnancy being an immunocompromised state, meaning their immune system in pregnancy tends to be a little bit diminished, they tend to get very sick, are hospitalized, can be in the ICU, and even up to death. It's been quoted in the literature. Pregnant women could have a tenfold increase in death from pneumonia. So this is very serious on the part of the mother who is not immunized. As far as the baby's concerned, there's an increased risk of miscarriages if a mom has an active case of measles, stillbirth, and premature delivery. All things that we could prevent if we could prevent them from getting sick in the beginning. While measles is not directly associated with any birth defects, if a mom is close to delivery and has an active measles outbreak, she can pass that on to her baby, which could be catastrophic with a newborn who contracts and has congenital measles. So this is a very important topic in our realm. As far as what we're recommending, if a woman is not pregnant, we're recommending if they're not immunized, we have not confirmed that either by documentation, meaning they have their vaccination records, which demonstrate that they have been vaccinated with MMR, the appropriate dosages, or they have not documented tests that they have had the measles, or so if they don't have those things, then we're recommending they get immunized if they're not pregnant. Pregnant women cannot receive the measles vaccination because it is a live attenuated vaccine, which means that there's active virus in it, so you would not give that to a pregnant woman. But all of our postpartum and our non-pregnant women, we're trying to be very aggressive in our outpatient settings, as well as when we're discharging women who have had babies. If they're not immunized, we're offering the vaccine. So when we have these, so some people would ask, what do you do when someone has been already exposed? If someone has been exposed and they're pregnant and they are not vaccinated, we cannot confirm that they're vaccinated. The key thing that will happen is we will then offer what's called IVIG immunoglobulin. It's an IV immunoglobulin. It's basically antibodies to help the woman's immune system to mount better response. If they should contract that disease, they would have to receive that within 6 days of exposure. Our facilities are prepared to administer that, labor and delivery. We have things in place for if there is an adolescent, pediatric, pregnant young woman, being able to get that to them as well. So we are very much pushing prevention, but we are very much aligned across the system to deal with exposures if it happens. We're very much geared up for if we have any active cases as well. And in that case, a woman may be hospitalized if it's very close to delivery and placed in certain types of rooms that will prevent the air from leaving that room, so that we can, obviously keep everyone safe on our unit and treat them that way. So Prisma has really across the board aligned all of our hospitals so that we can definitely try in our community to hopefully prevent, contain, mitigate this outbreak. And that's pretty much what I'd like to contribute as far as OB-GYN is concerned.
Thank you, Dr. Dickens-Carr. With that, we're going to now go to Dr. Anna-Kathryn Burch, who is going to talk about some additional measures that we're taking for or recommending for children.
Yeah, good afternoon, everybody, and thank you for coming to hear us speak about the measles yet again. Unfortunately, we are having to speak about the measles quite a bit because, as y'all know, South Carolina is the #1 outbreak since the 1990s when the United States had their non-endemic status given. And unfortunately, pediatric patients, especially those individuals who are 2 years or less, are at a much higher risk from having poor outcomes from the measles. And because of that, we are recommending as Prisma Health pediatricians to have parents who are either on the fence about getting their children vaccinated for the measles, or have children that are not yet 1 year of age to discuss getting their children vaccinated against the measles early. So traditionally, measles vaccine, the MMR, is given at 1 year of age and at 4 years of age. There's 2 parts to the vaccine series. The second vaccine is a booster vaccine. However, in times of an outbreak, which we are seeing definitely in the upstate, and unfortunately, we now have 1 case at least in the Sumter area, we are recommending that children, infants who are 6 months of age to 11 months of age be given the MMR vaccine early. The reason why we do this is because for two reasons. Number one, the children less than 2 are at highest risk for having bad outcomes with the measles. That includes anywhere from getting hospitalized to having pneumonias to having brain swelling called encephalitis, all the way to potentially dying from the measles. So this is the best way that we can offer protection to those infants at that age range from 6 months to 11 months of age. The second reason why this is important is because we all play a part in stopping this outbreak. And what I mean by that is the more individuals who are immunized against the measles in a community, the better chance we have to eradicating the disease in the community. And those individuals include those 6 month age individuals, 6 month to 11 months infants. So we're doing two things by offering early vaccination to those individuals. In addition to that, I had spoken earlier about the traditional time to get your booster vaccine is at 4 years of age. However, in a time of outbreak, you can give that booster vaccine early as well. You can give that up to 28 days after the first vaccine. So we do recommend you discussing with your pediatrician or primary care practitioner about having your children vaccinated early if your child falls in that category. Again, I want to stress that MMR vaccination is safe. It is effective. It is probably the most effective vaccine that we make in the United States. And so it is also the number one way to help protect yourself and your children from getting the measles. And so we recommend that you just really stress the importance of getting your children up to date on their vaccines. I also want to tell you my point from being a mother. I would not come on here and tell you information that is not true because I wouldn't want to do that to my children. Both my children are vaccinated against the measles, and I just really ask those individuals, if you're on the fence, to reach out to your primary care physician or to get good science-based information from reputable sources. One of those reputable sources is the American Academy of Pediatrics. They have plenty of information for you on the MMR vaccination and how safe it is. So I just really recommend those individuals that are on fence to please get good information so you can make the best decision about vaccination for your family.
Okay, Dr. Burch, I have a question in the chat. The additional spaces that we were talking about earlier, I think Dr. Lacroix mentioned them. Would that be able to isolate those who might be infected after the screening process? So I think.
Yes.
Hold on. Give me one sec.
Okay.
Let's see. There you go, Dr. Lacroix.
Yes. So particularly with people who may have a known exposure or clinical illness compatible with measles, it's very important that we get them into a private space. And as mentioned earlier by Dr. Dickens-Carr, a space that's called a negative pressure space. And so those physical environments are available, operational, and being used in our emergency departments, and additionally in our other spaces, both on the inpatient units, in our labor and delivery and obstetric units. All of these spaces have been prepared, ready, and are being used in the instances where our thought is that this patient has a high likelihood of having measles.
Dr. Lacroix, there's a question about, at the pediatric practices, do you have or are you considering and I don't know if you know the answer to this, but we can ask it, a policy in which you dismiss families that choose not to vaccinate?
So in pediatrics, and we've talked about this before, it is a physician and parent conversation, and it's an understanding of the parents' thoughts about vaccines and also being able to share the physician perspective of why their children may be at risk. The different aspects of their life that the parents may not view that as placing their children at risk for acquisition of some of these vaccine preventable illnesses, but that conversation is always a conversation that is had. The new term shared decision making is what we're using for the old-fashioned way of us just understanding a parent in what their thoughts are around this. And obviously counseling every time, being able to share information, to answer questions, and to bring the data of what we're experiencing in South Carolina to those families. I have done this for more than 30 years, and every family will have a point where one of these infectious diseases that are vaccine preventable impact their family or someone close to them or someone that is their child's playmate. And those pivotal times allow people to view vaccines in different ways. When we talk about this was a vaccine preventable illness, there is a different perspective that's had. So the conversation must always continue.
All right, Dr. Lacroix, give me 1 second. I'm trying to see all these questions. There's a couple of questions in the chat about numbers and some questions about specific patients. That is not information that we can provide based on patient privacy. But we are working to report all the things that we're supposed to from Prisma Health. So I'll just say that out loud because we can't provide any of that kind of information. I don't know if we know the answers, but I'll ask it anyway. Is Prisma Health aware of any measles infections among patient providers or staff that are associated with infections occurring at the system's facilities? I think I answered that, but I don't know if Dr. Lacroix wants to take that. I think we're reporting everything that we're supposed to report. That's pretty much the answer to that question. I don't know the answer. Dr. Lacroix, this question is, do you provide or recommend a titer test for people who were vaccinated 1963 to 1967? And should others complete this test if they are concerned about their coverage?
The group of people who fell with that early vaccine development, it was not as potent and didn't produce as large of an antibody response. So if someone were in that range and had that as a single vaccine, because remember, we added the second MMR to bring the protection from 93 to 97% after the initial vaccine was developed. So if someone was in that category, I think that there are really two options. You can certainly have a titer done, but you also could have a booster MMR provided. And as DPH shared, these boosters are available in both the health department and in commercial pharmacies and from your primary care provider. So I think discussing that with your primary care, particularly if you fell within that range, you've only had a single vaccine, it may be simpler to just receive your second vaccine, and then you are considered fully vaccinated at that point, and you don't have to move ahead for a titer.
And there was a question I just wanted you to just say this out loud. They just wanted to clarify that this is going to be required in all of our locations in the state.
Yes. All of the Prisma Health emergency department facilities and our delivery sites will have the common policy for masking.
Okay, I'm going to go to Dr. Dickens-Carr. All right, Dr. Dickens-Carr, there's a couple of OB questions in the chat. Let me find them. Has
Can
Prisma
I
Health
answer
had,
one in particular? There's no incident that has prompted this. This is a public health concern, and the measures that we are taking is to prevent any more spread. So there's no incident this has been in the works, and we've been working as an organization now for over a month to unify and align all of our hospitals. So we're doing the same thing, irregardless of the outbreak being in Greenville. We're just doing it across all our hospitals. I wanted to answer that question.
yeah, I think that was the question. They were asking
Mhm.
whether we had had any patients who were exposed to measles and actually needed the IVIG. I know that in one of the chats, somebody else is asking about a specific patient, but I don't have that information and we wouldn't be providing patient information anyway. Let's see.
Well, in general, we have it available. Patients have received IVIG.
Right, good deal.
Mhm.
Hold on, I saw another one about mothers and babies. Oh, Dr. Dickens-Carr, if someone is thinking or trying to conceive, would you recommend that they get the MMR vaccine?
If they're not immunized, I would. But the other thing is they shouldn't get pregnant for at least 28 days.
So say that again. So you're saying that if
They
you're
can get the vaccination, but they cannot, actively try to conceive for 28 days after that vaccination.
okay, I don't think I've heard that. Is there a reason why, Dr. Dickens-Carr?
That's just the science behind the vaccination. You have to give it 28 days to build your immunity and for that live attenuated virus to no longer be active. That's in the literature.
Okay, good deal. Hold on.
And so that would be the one shot. Now, if you did two, it would be 28 days after the second.
Okay, so this question is how receptive have postpartum and non-pregnant women patients of Prisma been to getting the vaccination and getting vaccinated, and has that changed over time as the outbreak has gotten worse? Have parents changed their minds as cases have mounted? That might be a question for Lacroix, but I don't know about the pregnant women, Dr. Dickens-Carr.
There are more women that are seeking out to be immunized and are concerned about it, and our postpartum women more are accepting it. Not all, but more are, just because of the outbreak.
Good deal. Thank you. I'm going to go to Dr. Burch. Okay, Dr. Burch, let's see. Trying to get done. This is a question, Dr. Burton, you probably can answer this. Um, uh, as a matter of policy and practice, how do we notify patients that have been exposed to measles, or do we do that, or is that something that we report and then DPH does?
Yeah, so that's a great question. That is traditionally done by the Department of Public Health. And what will happen if you end up being positive for the measles, the Department of Public Health would call and interview you and ask where you have been and who have you been around. The Department of Public Health has done a really great job in investigating these positive measles cases and trying to identify all individuals that might have been exposed from that person who had the measles, to let them know about the exposure, and also to find those exposed individuals to check what their immune status is. And if they are not immune to the measles, i.e. they have never had the immunizations before, or they are immunocompromised and never was able to get them the vaccines, or if they are not born before 1957. There's different measures that tell you if you've been immune or not immune to the measles. If you have not, then you go into a quarantine period for 21 days, meaning that you need to quarantine yourself from other individuals. there are ways to help try to stop the spread of measles if you have been exposed. So if you are not immune to measles and you have been exposed, you can get an MMR vaccine within 72 hours of that exposure period. If you are not immunocompromised, or you're not pregnant, or you're not less than a year of age, those individuals would potentially have to get IVIG, which is immunoglobulin, to help protect you from getting measles. Or if you do get measles, it would hopefully make it a more or less severe disease. And so there are those measures that we can help to do. And then the Department of Public Health also will interact with individuals who are exposed to tell them all of this information. But in addition to that, ask them to monitor their symptoms. And if they have any symptoms that would be expected with a measles infection, like fever or cough, runny nose, those kind of things, then you would let Department of Public Health know that and reach out to your primary care provider.
So it says, I know when the flu season comes around, health officials will tell people not go to the hospital unless they have life-threatening symptoms. Does the same go for measles? Are you seeing people come to the hospital with measles who don't really need to come?
Yeah, so it depends. Obviously, if you suspect that you have measles, meaning that you're not immune to measles and you've been exposed to somebody who has measles and you're experiencing symptoms, the best thing for you to do is make a phone call to either your primary care provider, or if you don't have a primary care provider, to the person that you were going to go see for testing. That could be either urgent care or the emergency room, to let them know beforehand before you come to that area. That is the best way to keep other people safe from being exposed to the measles.
Dr. Burch, I don't know the answer to this question. It says, does Prisma have additional notifications to its own patients when they're exposed in facilities, or is there a process for that?
So again, that is in conjunction with Prisma Health and the South Carolina Department of Public Health, and we help investigate those if it's within our facility. And between the two of us, we absolutely reach out to those exposed individuals.
I'm going to go to Dr. Lacroix. All right, Dr. Lacroix. So the question is, I know that we don't have the numbers of any additional exposures at the colleges. I know there were 2 that were named, and we don't have that information. That would be a DPH. But the question is about how can college students kind of protect themselves?
So many of the colleges have vaccine requirements and strongly encourage those. So I think if a student is there and has not been vaccinated and was not exposed in the original set, meaning in a period of quarantine, starting their vaccine series. Go ahead and get your first vaccine. That's going to get you 93% protection. So moving through and finishing this vaccine series is the best way to protect against this and a number of other college-related infectious diseases that are vaccine preventable.
All right, Dr. Lacroix, I think this is the last question. And I don't know if you know, so I'll just ask it. Without giving any identified information, have we, Prisma, seen any severe measles complications? And if so, what that would be like, I guess.
Yes. So we have admitted, we've assisted other facilities in caring for these children. Some of these children are very ill. Again, having been a pediatrician for a long time, when I go in to see these children, it is always so sobering to see how difficult this illness is for them. They look like they feel miserable. Their eyes are red. They're watery. They have this terrible blotchy rash that looks like it just would be uncomfortable. They are very listless. The older children describe very sore throats. They're dehydrated both from fever and from feeling so poorly. They are coughing and coughing and coughing. If you think back to a time when you had an illness where you could hardly catch your breath from all the coughing spasms, there is that. Then there's the secondary infections with the development of the pneumonias, because again, this virus, once it has done its initial insult to the body, produces a immunologic amnesia. And so these children are subsequently at higher risk of secondary infections and infections following the measles infection. And so we have seen the whole gamut of both acute and post-measles infections that have afflicted these children. They are sick.
Thank you, Dr. Lacroix. All right, so I think somebody's asking a question. They said, is Dr. Lacroix speaking of hospitalized children or others she may have seen?
So I am speaking of both. The children that we are evaluating through the practices, often telehealth has been a tremendous tool to prevent office exposures and to be able to evaluate these children. Sometimes multiple times a day, the pediatricians have been checking in with the parents to be sure that the children are not becoming ill to the degree that they're going to require hospitalization, meaning that they're going to need oxygen or that they're going to need IV fluids. So I think that it is both the degree of illness that we have seen both in children that have not required hospitalization and then certainly in those children that have required hospitalization.
Okay, Dr. Lacroix, somebody tried to ask my question before I got to it. So it's like, so I'm going to go back to all the docs and give them one message. So if you had one message to give to the people of South Carolina about this, what would your message be?
My message would be that South Carolina, as other states that have experienced outbreaks like this, does have the ability to protect our community, to protect our children, our immunocompromised people, the people who will have a very significant time and problem with this, like our pregnant women. We can do that. It's by vaccination that we have a very effective, very safe, readily available vaccine that everyone in our state has access to receive. And that is the most effective way for us to extinguish an outbreak.
Thank you, Dr. Lacroix. Just as a clarification, Dr. Lacroix, this is for all of our South Carolina emergency departments, because we do have hospital in Tennessee.
Correct. That is South Carolina. Remember that we have Toomey Hospital in the Sumter area. We have our Midlands hospitals. We have our upstate hospitals. And currently there is not measles activity in the Tennessee area, and therefore this masking has not been extended to the Blount County Hospital.
Thank you. I'm going to go to Dr. Dickens-Carr.
Okay.
Dr. Dickens-Carr, if you're going to give one message to women who are pregnant out there related to measles, what would you say?
I would say make sure you know your status. If you're already pregnant, you won't be able to be immunized. So I would suggest that if you have any idea of anyone that's possibly has measles, to kind of keep a distance and stay away from it. It's very contagious. But for my non-pregnant women and postpartum women, vaccination is the key.
Thank you, Dr. Carr. All right, Dr. Burch, you're going to have the final say here today. Dr.
When
Burch.
Yes, I'm here. So since Dr. Lacroix so eloquently talked about vaccination and how that is the key to stopping the spread of measles in our fine state of South Carolina, I'm going to say that the measles is more than just a fever and a rash. I hear that quite a bit from parents who think that what's the harm of getting the measles? It's just a fever and a rash. The kids will get over it. It's a rite of passage of, being a child. Honestly, I will say that measles can cause harm in very small kids. We've already talked about that. They can be hospitalized. They might have poorer outcomes than older individuals. But we also know that we are expecting in the next several months to up to a year worse bacterial infections in those individuals who have had the measles. That's where the majority of bad outcomes and death come from when associated with the measles. It truly is the secondary bacterial infections. And so I just, again, ask everyone to help the state of South Carolina protect ourselves. If you're not vaccinated, reach out, get good information, make a best decision for you and your family.
Those are the final words. We thank you so much. All our media partners, if we can do something else, you need assistance, it's news at prismahealth.org. And we thank you for helping us share this important message to our community. And everybody, have a great day.
Thank you.